So if you consider yourself pro-life, please, I implore you to watch this whole video. If you're not pro-life, you can scroll on or you can stay. I think anyone can benefit to hear this. I'm a doctor and I have been expressing my concern about the overturning of Roe v. Wade for quite some time now. And up until now, my concerns have largely been dismissed by pro-life people. I've been called a fearmonger, among other things. But we have data now to show just how harmful restrictive abortion laws are. So these data were published in the American Journal of Obstetrics and Gynecology. This is the article should you want to actually read it for yourself. Now, essentially, they looked at data from 2 hospitals in Texas after the passage of their very restrictive heartbeat law. And they looked at patients who were coming in with complications from their pregnancy, all of whom were before the age of viability, and all of whom had fetal heart tones at the time of presentation. Now, under normal circumstances, when patients would come in with these complications, the most common of which in this study was preterm premature rupture of membranes, the patients would be offered a choice to either terminate their pregnancy or to have expectant management, which is basically just watch, wait, and see how they do. Now, because this took place after the restrictive Texas heartbeat law, the patients didn't have a choice, the doctors didn't have a choice. This was state-mandated expectant management for these complications. And can you guess what happened? The patients suffered many more complications because they had to wait on average 9 days after presentation before the doctors could do anything. And the patients suffered complications like uterine infections, bleeding, requiring blood transfusions. One woman had to go to the ICU and be intubated. Another woman needed a hysterectomy. Now, 8 of the women had live births, but of those 8 live births, 7 of the babies died within hours of delivery. Another baby survived, but survived with several complications like germinal matrix hemorrhage, which is bleeding in the brain, pulmonary hypoplasia, meaning the lungs aren't fully developed, liver damage, necrotizing enterocolitis, which is the intestines don't get enough blood supply and they start to die, as well as a congenital heart defect. They also compared the maternal morbidity to these patients who had to undergo state-mandated expectant management to other patients in other states who were allowed to have immediate intervention, including abortion, and you can see that the patients who were forced to wait had many more complications, almost twice as many. Now, I think a lot of you have insulated yourself in this delusion or this false belief that patients are always going to be able to get medical abortion should they need them, but the laws aren't clear-cut. This is creating a lot of confusion, and unfortunately, a lot of patients are going to suffer the consequences. And you're going to somehow have to reconcile your pro-life beliefs with the reality of the situation, which is the exact opposite of pro-life. This is pro-trauma, pro-disease, pro-death, and pro-suffering. You have to deal with that.